Okay, so welcome to Dr. Chan's Minor Ailments Forum again. So following the previous video that I talked about menopause, I'm going to spend some time to talk about HRT treatment. So, there's actually two schools of saying whether doctors should prescribe HRT or not, and depends on which side of school you are at. We've got completely different point of view, but I'm just going to give you a more kind of neutral point of view to give you some information to decide whether, number one, you need to be on HRT or not, or number two, whether you're suitable. Okay, so I won't go and talk about menopause again, but I'm just going to talk about what are the pros and cons of being on HRT, what kind of delivery methods the HRT have, and also what kind of follow-up we need if you're on HRT. Okay, so bottom line is HRT have side effects, okay, but also got the benefits, so you need to weigh it up quite well yourself. So let's just talk about what does HRT do. As the name suggests, hormone replacement therapy. You're replacing the hormones that you're lacking of. So in that kind of situation, the people who are on HRT, generally speaking, get very good results on resolution of hot flushes. That's the main things why people want to get onto HRT, really. And secondly, on a short-term basis, apparently, if you're on HRT, your mood tends to be better as well, and it can help with depression. Now, if you're in the category of having early menopause or premature menopause, then it might be beneficial for you to be on HRT until maybe an age of normal menopausal age, like 51-year-old. Because if you're having early menopause, that means you are low in estrogen, and low in estrogen can potentially put you at risk of osteoporosis down the line, which is thinning of the bone. So in that case, if you replace the hormone, you might prevent or reduce the chance of these people getting osteoporosis in the future. So basically, the criteria for people to start on HRT is in a well-informed woman, they understand the pros and cons of these medication, and the symptoms are severe. I mean, the menopausal symptoms are severe, then they can be considered for being on this medication. But we generally do not recommend for people who age over 60 to start on HRT. And in theory, really, once you hit a certain age, I would say around 55 to kind of 60-year-old, you might want to think about come off them, or at least reducing the dose to prevent side effects in the future. Okay, or in another indication for starting HRT is if you are young, for example, from 40 to 45, and you're already going through menopause, then it's worth being on it to protect your bone in the future. Okay, so the good things about HRT, as I've mentioned already, basically is improve your well-being mentally and physically, reduce the vasomotor side effects, for example, hot flushes, and improve mood as well. And there's been studies showing that if you start someone on HRT, in a way you actually protect them cardiovascularly, so they have less cardiovascular events when compared to those who are not on it, but obviously not in those people who are in a slightly older age. For example, if you start someone on HRT age over 60s, then you would be at a much higher risk cardiovascularly. Okay, so obviously, there are bad things about being on HRT as well. For example, you're at a higher risk of getting breast cancer, cervical cancer, bowel cancer, put you at a much higher risk of having a clot in the legs or a clot in the lungs or stroke. So these are the things that you need to kind of consider before you asking for HRT or being placed on HRT. Okay, there are some 100% contraindications that need to be aware of. Okay, so for example, if you're pregnant or breastfeeding, that's a big no-no. You can't be on HRT. If you have undiagnosed abnormal vaginal bleeding, that's another indication for not being on HRT. If you had a blood clot before, like a DVT, probably not a good idea. If you have had recent angina, which is chest pain without exercise, or or with exercise, or even had a heart attack, then that's a no-no for you. If you are suspected or currently or previously had breast cancer, you can't be on HRT. Let me have a think. Endometrial cancer and other estrogen-dependent cancer as well, it's not okay for you to be on HRT. And another two things would be active liver disease and also uncontrolled high blood pressure. So these are the things that will, prevent you to be on HRT, really, as previously mentioned, that because you do have a side effect of being on HRT. Okay, so you might say, okay, I fit into all the criteria for okay to have HRT and I would like to try them. So what do I need to do? How do I take it? So it depends on what kind of symptoms you're having, really. So common thing is obviously a tablet to take, or using a patch. But sometimes if your symptoms are not that severe and it's like quite localized, for example, let's just make something up like vaginal dryness, then maybe a topical gel or cream would be suffice, really. And sometimes, there's some funny delivery method, for example, nasal sprays, and sometimes a Mirena coil, and even a vaginal ring that is available as well. So it's loads of different kind of delivery method to suit different people in different situations. Okay, so obviously if you're on HRT, as I said, we want you to be on the shortest period of time, in order to prevent, side effects and gain the most of the benefits. So we need to make sure that we have at least a yearly review with your GP to check your blood pressure, do your weight, and talk about potential side effects and symptoms. And when you hit the age of maybe 51 to kind of like 60-year-old, we might kind of have a discussion of, do you think that you can come down the dose on the HRT, or maybe even coming off it? Because at the end of the day, people go through natural menopause around the age of 51 to kind of 60. So it's kind of worth considering coming off or coming down the dose of the HRT to prevent further side effects that we mentioned earlier on. So so this is just a quick whiz through of what is HRT, what is the delivery methods of HRT, and how long you should be on it, and the indication of being on it. So I hope that this is useful for you, and this is just a prompt for you to kind of go and have a discussion with your own GPs to find out more about HRT and see whether it's suitable for you. Okay, so thanks for listening today, and I hope that this video is useful for you. Okay, take care for now. Bye bye.